Hello, I'm Carolyn Monahan, Director of Marketing and Communications with the West Coast Chamber. Today's member question focuses on the COVID vaccine, talking about it from an employer standpoint. So I am joined today by Adam Zuwerink, attorney with West Michigan Law, and he's going to talk us through a little bit about the history of vaccines and things that employers should consider when they're trying to set policies for their businesses as far as their employees being vaccinated. It can be very controversial and complicated. So I'm really excited to have you here with us today. Thanks for being here, Adam.
Yeah, thanks, Carolyn.
So let's back up a little bit. And can we talk about the legal history of mandatory vaccines before we were in the time of COVID?
Yeah, absolutely. I'm going to see if I can give the 200-year history of mandatory vaccines in America in under 2 minutes. So it all started in 1809. The state of Massachusetts was the first state to mandate a vaccine for smallpox. 1905, the Supreme Court of the United States upheld the mandatory smallpox vaccine under the theory that states have the ability to protect public health. So when we say mandatory vaccines in America, what most people normally think of first is public schools. And in order for your kids to go to public schools, they have to get vaccinated. Well, most of these laws came out in the 1960s as a response to the measles outbreak. Also, a number of states started mandating vaccines for healthcare workers. A hospital in the state of Washington was the first hospital to mandate the flu vaccine as part of a condition of employment. And then in 2008, the Department of Defense and the federal government level started mandating the flu vaccine for all healthcare workers in their medical facilities.
So you've established that we can mandate vaccines. So now we look at, should an employer mandate a vaccine and what can that mean for them?
Most states have two opt-outs where even if it's mandatory, an employee can still opt out. The first is for religious reasons. So let's assume for a minute that an employer does mandate the COVID vaccine. If one of their employees comes up and says, I cannot get the COVID vaccine because of religious reasons, the employer should just accept that at face value and try to come up with some type of a reasonable accommodation for that employee. The second opt-out reason has to do with the Americans with Disabilities Act. Most of us know it as the ADA. All of the analysis that you're doing under the ADA already for your employees, it's the exact same for the COVID vaccine. The two things that I've been hearing and reading about, what would be a reasonable accommodation for someone who cannot get the vaccine. One is remote work. Well, for the past year, if your employees can work remotely, they already are. So that's, just keep doing what they're doing. But then the other is potentially making those employees continue to wear a mask, even until COVID-19 is completely gone and we have herd immunity. Could be a reasonable accommodation to make those employees still wear the mask. The other question that keeps coming up is actually physically administering the vaccine itself. The actual physical act of poking someone in the arm actually does not implicate the ADA. It's not considered a medical exam or anything like that. The COVID-19 vaccine is not any different analysis than any other ADA analysis. So it's just making sure you're asking questions that actually have, a necessary business purpose, but then also making sure not to take any adverse employment decision against an employee based on what they tell you in answering questions about whether they can get the vaccine. I want to talk a minute about should employers actually mandate the vaccine. My opinion is no. And honestly, I think you're going to see very few employers actually mandate it. But I also would not shy away from doing everything possible to make sure all of your employees actually do get vaccinated. So things like if you want to set up a facility on site, I'm thinking for like manufacturing facilities. if they want to have someone come on site to administer the vaccines, if you want to pay for the vaccines for your employees, even if you want to give them paid time off and get vaccinated, when that time comes in a few months. I just think in America, there's a significant portion of our population that just struggles with being told what to do when it comes to public health. But employers should absolutely do everything in their power to make it as easy as possible for those employees who do want to get vaccinated.
Is there any employer liability concern if an employee has an adverse reaction, especially if they're administering these vaccines on site?
There's really not. I think the benefits of having your employees vaccinated far outweigh any potential drawback.
Mm-hmm.
So there is this one federal law out. It's called the Public Readiness and Emergency Preparedness Act. They call it the PrEP Act. Basically is giving liability immunity to employers for anything that would happen if they have vaccinations done on site. If one of your employees gets vaccinated, they do have an adverse reaction, they do have to miss some work, there's a good likelihood that has to be reported to OSHA as a work-related illness.
Mm-hmm.
And then potentially there's a workers' comp claim there as well. So even if there's not, actual legal liability, there could be reporting requirements that have to go along with the vaccine.
Sure.
And then the other quick thing to mention that I haven't yet is if the employer has union workers, so as a union shop,
Mm-hmm.
they should really negotiate the terms of the vaccine distribution with their union. And I think now's the time. I mean, we're really talking about something that's going to be, probably 3 to 5 months down the line.
Mm-hmm.
But now is absolutely the time for employers to start thinking about it. Start figuring out, are we going to have someone on site to administer vaccines? Maybe even take a poll of your employees and see what percentage is interested in, getting a vaccine through their job.
Yeah.
So now is absolutely the time to start thinking through those things for a few months from now.
Thank you for taking the time to
Yeah, you're
talk with me
welcome.
today and for doing all the research that you did. I really appreciate that.
Yeah, you're welcome.
Have a great day.
Thanks, you too.